I was trying to balance therapy. I was paying for therapy out of my own pocket. Wasn't working. I've been down that road. I've done group therapy. I've been hospitalized. I'm never going back. It was terrible, scary. It's not me. The day I showed up, I knew this is not it. And the medication thing, I've it sure I didn't feel sad. I didn't my emotions weren't all over the place, sure. But at 34 to be placed on these horse pills for the rest of my life, like that's not an answer. How come there's other people around me who don't need to take this? There's something I'm missing here. And then when you and I met, we started this work in this process. It was immediate, that question of, right, so this medication you're on, what sort of conversations are we having about anything? Your relationship with your parents, your wife, your children. What was your childhood like? None of that I had ever been asked, uh, ever.
So you were diagnosed with depression and you were prescribed medication for the rest of your life without any conversation about childhood experience, past trauma, anything of that sort.
No goals set up. No, it really felt like my prescribing doctor wasn't rooting for me to to do something so that I'd never have to see her again. We want to get you better, get you on your way, and get you out of here. Whereas this work, I have the tools I need to turn away and never come back. I don't,
Yeah,
you know,
that's what I
essentially.
say to people. I say I do not want to see you in 6 months' time.
Yeah,
Um,
it's true.
what about the therapy you did and the group therapy? Did that not dive into your past? Did that not bring anything up or give you any solutions?
The individual therapy I paid for out of pocket was just, it felt like me just talking into the screen. I see my therapist, and she would maybe ask a question about, how was your week last week? Okay, tell me more. Tell me more. Tell me more. That's interesting. And it just felt like I was talking to a semi interested friend versus
An
a
expert
therapist.
with any answers at all. It's a joke.
Yeah.
I mean, just talking about it makes me angry. It's some kind of racket. And the people that go to therapy, there's two types of them mainly that I meet. Number one, some people do have a good experience when they first go because they're like, oh, I've got some kind of help, I've got some kind of support. I'm talking to somebody that's like better than nothing. So they have an initial release. But there's those types of people, but and then they figure out pretty quickly that they're just in like a circular problem, and it doesn't get any better. Or you got people that are like, yeah, I've known my therapist for like 15 years, and yeah, we're great friends. I'm like, that's not a solution. That's just like a lifelong client relationship that benefits the therapist. I
Yeah,
even had
just
one guy said to me, look, I really want to do this work with you, but I'm too afraid that I'll upset my therapist if I tell them that I'm not going to work with them anymore. This was like after 10 years.
that's already too far gone.
It's crazy. Um,
The group therapy, yeah, it's really just what's on your mind. Bring it up. What's on your mind, which I feel like is your attachment to an emotion and what you're thinking. It's not. It's what you want to share with in a group setting with
hmm.
people. Not for me.
Yeah, again, I don't think there's anything wrong with it, but it's not a long term solution because there's no framework to it.